Thank you so much. We appreciate that insight. Moving to you, Dr. Hamza. AI systems are good, but they're only as good as the data they are trained on. For example, when you are deploying an AI system or solution that is setting either reading on reference ranges or disease diagnosis, it's going to be as accurate and as good depending on the data that you're exposed to it. But also, this does not take away the bias and how that leads into unbalanced healthcare outcomes. So, as we embrace AI-driven solutions, how can AI-driven solutions balance healthcare delivery without exacerbating existing disparities?
James, you did mention that's a very important question, because a lot of the challenges that most people are having right now is just, they have the technology is good enough. And when they are ready to go to market, the problem is that it's only good enough for a certain group of people, but not everybody. So yes, AI has all these really, really good qualities that it comes with. But until we're able to go beyond those three hurdles, which you've mentioned one, which is getting and making sure that the data that we are training those AI models with is diverse enough to be able to make sure that it represents the black population, it represents the Hispanic population, it represents the white population accurately, then it's still going to be a problem. It's just going to deepen the disparity anyway, because it's going to skew towards one population than the another. The second thing that we need to address if we want to look at this, and I'll go into specifics, is to make sure that these AI models are accessible to the communities. What does this mean? These are driven by internet accessibility. And if we are going to talk about this into detail, in America, we have at least 93% of people who are very, very comfortable with it. They don't have to think about the data running out. We have hospitals that are fully online. We have diagnostic centers that are fully online. So these infrastructure make it easy for you to adopt these AI technologies. Without that, again, yes, we are going to be deepening that disparity. And the third thing we need to look at is the ethical items. So let's look at this in terms of equitable data representation. So I did mention initially that most of the research that they did, especially spanning from 2019, showed that 30% of the time the data is more accurate in the white population than it is in the black population, which means that whatever was used to train these systems was more of data that related better with the white population and the black population. Now, Stanford University had decided to go further with one of the AI tools that was used to diagnose skin cancer diseases. And when they ran it, at first, the margin of error was about 20%. So what they did was they decided to start training it with more diverse data to see if they can improve the accuracy. Now, the moment when it gets to that point, they were only able to improve it by like 5%, which means 15% of the time it was still skewed towards the white population, more accurate than it is in the black population, right? So the first thing is that if we want to use AI to ensure fair healthcare, we have to be sure that the data we are training it with, right from the beginning, and maybe Rufi might be able to speak more to how these models are trained, but right from the beginning has to be diverse information that makes it easy for this AI model to interpret the results accurately across all groups. That's the first thing. The second thing we have to do if we're deploying these services is to make sure that we're expanding access to this AI-driven care. What does that look like? If we have just 40% of the African population who can comfortably be online, and maybe I can possibly count the number of healthcare facilities in Ghana who are online, then we are looking at a problem where even if these AI-driven solutions are available, as a continent in Africa, we are not even positioned to use them accurately. So again, that fair distribution, that fair utilization of this AI-driven has to come with an expansion of access. What does that look like for us? We have a lot of broadband services that are in all these African countries. So when you look at companies like Zipline, they are only successful in Rwanda because they've been able to partner with local broadband organizations. So that has helped them to be able to deliver their services. And now 75% of glass supply in the country is through these drones that Zipline deploys. When we go into the last bit of it, which is about the ethical side of things, we have to be careful not to train an AI model on male-centric data and making it biased when it's interpreting female information. We have to make sure we are not biasing the information to a specific ethnic group or ethnicity that biases the interpretation of the data. If we can get beyond these three, then yes, AI would become a tool that would not only improve access, but it would also improve outcomes of whatever we have to deliver.